Good morning, everyone, and welcome to UroNurse News. I'm your host, Vic Senese, and today we're diving into a promising new approach to renal colic management, sterile water injections. So renal colic is pain caused by a kidney or ureteral stones that can be excruciating. It affects about 12% of people worldwide at some point in their lives. Now, traditionally, we rely on things like the non-steroidal anti-inflammatories or opioids, or plain old acetaminophen, Tylenol, to manage this pain. But each comes with potential side effects, from nausea and sedation to GI complications. Enter sterile water injections, or we're going to just call them SWIs because we're cool. Originally used for labor-related back pain. SWIs are being studied as an alternative analgesic for renal colic. A recent meta-analysis of 6 randomized controlled trials, including 1,322 patients, looked at the effectiveness of SWIs compared to traditional analgesics and placebos. Here's what they found. Lower pain scores at 30 minutes post-injection compared to placebo and some conventional analgesics. Reduced need for rescue medication. Patients receiving the sterile water injections were less likely to need additional pain relief. Minimal side effects, mostly just, the side effect of being stuck with a needle. There really is nothing from the water. To break it down, patients receiving SWIs reported a median pain score of 1.74 out of 10. So we do it on a scale of 1 to 10. That means, a 2 or less at 30 minutes. By comparison, patients receiving diclofenac, that's the non-steroidal, scored slightly higher than those on placebo. Acetaminophen or tramadol scored much higher. Tramadol is kind of the go-to drug for most of us treating renal colic, indicating more intense pain. Interestingly, sterile water injections perform similarly or better than opioids and non-steroidal anti-inflammatories, but with fewer side effects, a crucial factor for patients with things like renal impairment, pregnancy, or GI risk. These are something to look into. Now, how do they work? Here are a few proposed mechanisms. Something called diffuse noxious inhibitory control. Basically, pain from the injection can help suppress other pain signals. Now, I know that sounds crazy, but trust me, I've seen that happen. In the old days when you were going to give somebody a shot, you could either give them a little slap before you gave them the shot or even a little pinch. That pain would actually numb the injection so they wouldn't feel the needle. Crazy tricks we have. Endorphin release. The small irritation from the water triggers the body's natural opioids. Definitely. Gate control therapy. The injection stimulates certain nerves to block pain transmission to the brain. And anyone who's ever used one of those electrical TENS units, I use one quite a bit because of back pain, will swear by how much they can block pain just by stimulating with another type of pain. So sterile water injections are quick, low cost, they should be almost no cost, relatively safe, making them an attractive alternative, especially in emergency settings or for patients who cannot tolerate standard medications. Now, a note of caution, while results are promising, the quality of evidence varies. The number of trials is still relatively small. Experts agree that more high-quality studies are needed to fully integrate SWIs into standard renal colic treatment. But for now, it's offering an exciting, minimally invasive option that could help thousands of patients manage acute kidney stone pain more effectively. Well, that wraps it up today and this week. Briefing on sterile water injections for renal colic. Stay tuned to UroNurse News for more updates on innovative, patient-centered approaches in urology. Hey, this Saturday, that's tomorrow, on UroNurse, premature ejaculation. One of the most common sexual health concerns for men. It's often misunderstood, stigmatized, and surrounded by myths. Join me as I sit down with Jeff Abraham, CEO of Promescent, I said that wrong the first time, to break it all down. The real causes, persistent misconceptions, and treatments that actually work. Don't miss this eye-opening conversation that separates fact from fiction and gives men the answers they've been looking for. Tomorrow, 9 a.m. Check it out at uronurse.com. I'm Vic Senese. Thanks for watching UroNurse News, and don't forget to like and subscribe, and see you for more stories next week.
innovate.